any rate, welcome everybody that's here and thank you for coming. This is a webinar about the Viveve, which is a medical technology company that focuses on improving women's quality of life and intimate health. And then they named a machine after the company name Viveve. So the machine is also called Viveve. The Viveve machine was formulated really to increase vaginal rejuvenation, and they found that it did many other things at the same time. And their main goal was to enhance a woman's sexual life longer than what normally can occur, especially if they're not on any hormones. So the mission of the Viveve company itself is totally about women. They're using products that are clinically proven. They're going for FDA approvals in 5 different categories, and they are moving quite readily along in that arena. The Viveve treatment itself is really geared towards initially vaginal rejuvenation, and then they found that stress incontinence was relieved also. So they've filed to have FDA approval for stress incontinence. I was interested in both, so I became very interested in this machine. And I actually have tried other machines out also, which I'll talk about in a little bit. But at any rate, with this today, what we're doing is, because I believe everybody should look good on the inside and the outside, I give away a free facial if you sign up to have the Viveve treatment done at the end of this webinar. The hydrofacial is an amazing machine also that will exfoliate, and then we put product back into your face. It takes about a half an hour, and it's a totally rejuvenating experience. It's fast, it works, people look great afterwards. You can come in and do it before a big dinner or party and look absolutely wonderful leaving. So that's my gift to you. Who am I? I am Valerie Donaldson. I am board certified in both internal medicine and emergency medicine. I then became certified in anti-aging and functional medicine, got certified in bioidentical hormones, got certified in stem cells and platelet-rich plasma therapy, and also I've currently gotten certified in peptide therapies. My hobbies have always been in my whole life horseback riding, running marathons, doing hot yoga, and I love to do extreme skiing. So all of these different athletic activities really led me into the arena of, and I have 5 kids, by the way. So with all of that, it led me into the arena of having some trouble with stress incontinence. So I was quite interested in this Viveve in order to see what would happen to me. A lot of other women I found also in my hunting down of, why is this happening to me and how can I change it? I found that a lot of women were also experiencing stress incontinence and urinary leakage, especially after childbirth. So if you laugh or cough or sneeze and you have some urinary leakage, then you have what we call stress incontinence, and it will continue to become a problem as you get older. So if that's going on with you early on, right now, I don't know what ages everybody is, but if you're a younger age, I definitely would have this treatment done. It's really awesome for stress incontinence. You can do Kegel exercises for stress incontinence, and you can do different handheld devices, which we'll talk about later, also for stress incontinence. But the thing that gave me the biggest bang for the buck was with the Viveve. Stress incontinence affects women in many different ways. And truly, it's interesting when I was putting this together because I, was reading what people said, and it really is that if you have stress incontinence, you start living your life a different way than you used to. And it's embarrassing, and you tend to not do things that you used to do. I tended to not run as long as I used to run. So you really change your lifestyle into a lifestyle that's really not fitting to your usual self or to what you want to do athletically. In my reading, I found that actually a lot of athletes had stress incontinence even at early ages, and even 25% of the college athletes had urinary incontinence because of the stress of the vaginal area during athletics. Also, in athletics, your hormones tend to go down a little bit, so you don't have as many hormones to help you out with the vaginal area. All total, about a third of women experience urinary incontinence, which is quite a few women. The traditional treatments for urinary incontinence are not fun, and I really wouldn't want to do any of them. There's just routine care in using pads and protection, and doing laundry runs about $900 a year per person if you have stress incontinence. Pessaries were placed and as kind of an old form of therapy, and it's very uncomfortable and is not pleasant to have done, nor does it smell very good. So the 6 things that convinced me to try the Viveve for a treatment for me were the fact that there were clinical studies supporting the use of the Viveve, the fact that it was a pending FDA approval for stress incontinence. I did meet with the CEO early on and was impressed with his focus on women's quality of life and creating a machine for women that was easy to do. You didn't have to keep coming back for treatment after treatment like the other machines. And I did try the other machines. And in those machines, you have to come back like once every 3 weeks. And I found it disruptive to my lifestyle because I'm on the go all the time. And the treatment time was just as long as the one treatment time in the Viveve. So with the Viveve, they gave you the single treatment application. In fact, the company does not even want you to do another treatment for at least 6 months, if not a year. So that really appealed to me. When I used Viveve for the first time, it did work. It was amazing, and I loved it. So I immediately had to get it into the office. The Viveve is different than other machines in that it combines 2 different kinds of treatments together. It combines a cryotherapy and a radiofrequency that are applied at the same time to the vaginal area. And when you have those 2 different treatments applied to the vaginal area, it's usually not painful at all. And it becomes a pleasant experience, and an even more pleasant experience when you leave. The side effects I found were absolutely incredible, as does every woman that does the Viveve. They will tell you the side effects from the Viveve put smiles on everybody's faces. So the side effects of the Viveve are you get increased vaginal lubrication, you have increased orgasm, you have increased libido, you have increased strength of contractions in the vaginal area. You have decreased urinary tract infections, and sexual dysfunction goes down significantly. So the side effects are pretty amazing. And the side effects are what happens when your vaginal area becomes rejuvenated. And it is especially wonderful for women who have been taken off hormones or can't be on hormones. They can still get the feeling of being on hormones and have their vaginal experiences be similar to people who are on bioidentical hormones. The best things about the Viveve then are vaginal rejuvenation, which gives you a lot more intimacy with your partner. It gives you an interest in sex again. Your orgasms are amazing. You feel alive and you feel like you have vitality again. When it's decreasing the stress incontinence, you feel like you're free and you can be you and do what you want and jump up and down and not be afraid of leaking urine. It is amazing. So how does the Viveve work? The system, as I said before, is a radio frequency system combined with cryogen. And when you combine those two, it goes through the vaginal wall into the tissues. And the tissues then are directed to increase collagen formation. So it's thickening the lining of the vagina, and it's increasing the ability of the muscles to contract. When you come in, there's really not a whole lot of things to do or rules to follow. There's no medications used. We don't use any anesthesia. We do use some numbing cream if a patient wants it, or they feel that they would rather be numb than feel the process going on. But it's certainly not necessary. And I think there's only been one person that actually wanted to have a little bit of numbing cream put on. But the device is placed, and I'll show you a picture of what it looks like in a minute here. But the device is placed in the vagina and rotated through the vagina to get the entire vaginal wall, and then certainly up where the ureters are to decrease stress incontinence. The sensations you feel are just being warm or cool. If you're a candidate for Viveve, yeah, anybody over the age of 18. If you're having any stress incontinence, if you're passing air from your vagina, you have dryness in the vagina, laxity, or poor orgasms or decreased libidos, it's a prime experience for you to do the Viveve. And we have a wonderful nurse that comes in and does the therapies, and everybody falls in love with her too. So it's a very pleasant experience here. The warnings and precautions, just to go through really quickly, are if you're pregnant, we don't do it, of course. And if you're planning to become pregnant within the next 6 months, it's you're advised not to do it. If you're currently breastfeeding or have been breastfeeding within the last 6 months, we ask that you don't do it. If you're currently going through chemotherapy or radiation therapy, you should not do it. If you have any open lesions, if you have any large metal implant or any medical condition that you're taking chronic anti-inflammatories for that could slow or interfere with the regenerative process. If you have a chronic vaginal or medical condition such as infections, we want the infection to be cleared before you do the treatment. And then if you're allergic to any specific component of the Viveve treatment at all. What you can expect is a comfortable one-time 45-minute treatment in office, and it's actually very pleasant. Women feel the results in about 30 days. They usually feel full effects at 3 months. And sustained results really are documented at 12 months. We have women that have gone 2 years before they come back again for another treatment. What patients are saying really it's pretty amazing. It brings joy to my heart every time a woman uses a Viveve, because when I talk to them after their experience, they're always bright-eyed and smiling and saying, thank you for saving my marriage. Thank you for bringing, sex back into my life. Thank you for the intimacy that I'm having with my husband again. It's really wonderful.